Hello and welcome to the incisional biopsy procedure video. Here we will be demonstrating how incisional biopsies can be used to help diagnose pigmented lesions and immunobullous conditions. For this procedure, you will need a surgical marker, a scalpel, forceps, a suture kit, sharp spin, gloves, and optional scissors. For demonstration purposes, we will be performing the procedure on pig skin, so let's begin. Prior to starting your procedure, you want to make sure that you've completed all of the following: a pre-surgical check, a detailed consent process, that you've established your sterile field, and used appropriate local anesthetic. For help with any of these, please refer to the accompanying videos on the pre-procedure aspects. Identifying the most representative area for incisional biopsy is incredibly important. Assuming that the marked area is a blister, the surgeon draws a new elliptical area using a surgical marker that includes half blistered and half perilesional skin. We do this as the perilesional skin is required for immunofluorescence, and histologically a lot of information pointing towards a diagnosis can be found at the junction area between blister and normal skin. This line represents the area of the specimen that will be separated for immunofluorescence. Using the same technique as before, creating traction on the skin using the non-dominant hand, then using the scalpel, making a sharp incision using the point of the blade beginning at the apex of the ellipse, before moving towards the opposing apex using the belly of the blade. When you are ready for the sample to be freed from the skin, use forceps to gently hold the specimen as you use the scalpel to free it from the remaining skin. Once free, place the specimen onto a hard surface. We are using the back of a suture packet here. Then slice down the previously mentioned line separating the specimen into two. The lesional skin side is sent to histopathology for testing, and the perilesional skin for immunofluorescence. To finish, like before, a simple interrupted suture is placed through non-lesional skin. This process can take a little time, so what you are seeing now is a sped up version. Once this is completed, then an appropriate dressing can be applied and aftercare would then be provided. This concludes the incisional biopsy procedure. Thank you for watching, and we hope that you enjoy the other educational videos in this series. For more information on all of our educational resources and upcoming courses, please visit our website, stjohnsdermacademy.com. Finally, thank you to our partners who do not have any influence over any of our educational content or delivery. Please visit the Partners tab on our website for more details. Thank you, and see you again soon.